All right, caring for a loved one with dementia can be overwhelming, emotionally, physically, and financially.
Well, there is a new program that can bring help right into the home at no cost to families. We have Frank Barton here from Right at Home to tell us how this guide program works. It sounds too good to be true. How does it work?
That's a great point. It is wonderful. It's the first time Medicare has actually provided ongoing support to families for those with dementia. So it's a wonderful new program. It starts with seeing a clinician. So if you already have a clinician, we highly recommend going and seeing your clinician and asking about the guide program, which is a long-term support program meant to help not only the person with dementia, but their family deal with the dementia and everything that goes with dementia for the years that the disease occurs.
Specifically, what does this program do? How does it help families?
It gives support structures, both social, emotional, mental support at times as well. It also provides care, like my agency provides, respite care. So it will provide free caregiving directly into the home, up to about 72 hours a year and ongoing. So that the primary caregiver, when they're getting stressed, when they're getting frazzled, if you will, they actually have someone paid for by Medicare who will come into the home and give them a break, give them that respite care so that they can then focus on their loved one when they get back or when they've taken a break to help them get through the difficult days of providing care for someone with dementia.
And that it takes a lot. How much of this care is covered by Medicare?
It's the full 72 hours is paid for by Medicare. People can get more that's private pay, or if someone's a veteran, the VA, for instance, also provides this type of care as well through agencies like ours.
For those who haven't had to experience this, talk about how it is such a stress on families that have to go through something like this.
It affects everyone in a family. Often it's the elderly, but it can affect not only their spouse, their children, even grandchildren. Here in Utah, we love our big homes, so grandchildren may even live with a grandparent, so it affects everyone. There's the physical part of caregiving, but there's also the emotional part of caregiving that's very difficult, and so this guide program actually gives supports through all of that for folks.
I know I have a sister whose husband, she's helping take care of him, and it's slowly getting worse, but she needs to approach him to say, hey, we need help.
Yes.
And she's also taking care of their grandchild.
Yep.
And, you know, doing so much when she doesn't want to let go of that care. How do you approach them to say, hey, we might be able to take advantage of this help?
Yes, I think it starts by seeing the clinician. They also have social workers and even care navigators who will help families with those discussions. And you want to start somewhere, so even just a little bit of care is wonderful. Here locally, we have both the University of Utah and Intermountain Health that are both guide partners with us. So if you're in those systems, you can go see your clinician and ask about guide, and they can help and get you connected to those social workers, for instance, who can have those individual conversations with families.
Because everybody's different.
Yes,
Yeah.
Everyone's unique. All dementias are unique. And every family has their own issues. And you're right, the people who need the care often are resistant. And so that's why this program is so unique, because it does give individualized care beyond the clinic, even 24/7 supportive care, because people with dementia have problems not just 9 to 5, Monday to Friday.
Yeah.
I mean, you say go see the clinician, right? Are there certain qualifying characteristics that would allow somebody to be qualified for this program?
Yes, you do need to have a dementia diagnosis.
Okay.
I should also point out as well, for those who aren't near clinics or whose clinics aren't part of the guide program, there is a national telehealth provider called Pocket RN, and you can Google Pocket RN, and they even have a 1-800 number. You can call them and start to create the process from there just with a 1-800 number. So it's meant for not only people who are near clinics or in the urban area, but who are also out in the rural areas as well.
And now you are the Utah arm of this. It's a national program, right?
Yes, it's a national program. Like I said, locally, both Intermountain and the University of Utah have signed up to do this. We're their local provider. But if you have loved ones, even if you're helping someone from Utah, but your loved one lives in California, you can still have the guide program help you, and you can still get that ongoing support to help you help them, even though they don't live right by you.
How important is this to you? Why do you like doing helping in this sort of a journey?
Oh, well, I've done this for over a dozen years. I started this originally because my mom had Alzheimer's. She, of course, has passed away now, but my family went through this. And actually, one of the most important meetings my family ever had in caring for my mom was with a social worker. But we only got that because we were in a fairly unique research program at the time through the U. So this new guide program will give that kind of support to all families for those with dementia that are on traditional Medicare. That's another good point. This is a traditional Medicare benefit.
Okay. Traditional Medicare is different from
Advantage plans.
Advantage
So
plans,
the Advantage plans might have something similar. You need to ask questions about that, but this is for traditional Medicare.
Okay, and incredible to have your experience. And
Oh.
all of your family members probably went through it in a different way.
Absolutely.
Yeah.
That's why it's so wonderful to have this one-on-one support, even over the phone or face-to-face with social workers.
Yeah.
And real quickly, where can people go to get more information on this?
They can Google Right at Home Salt Lake.
Okay.
They can also even give us a call locally, 801-758-0630.
And Pocket RN is for rural
Yes, and
Okay.
national.
and national health.
Yep.
Okay.
Frank Barton, thank you so much.
Thanks.
We appreciate it.
You're welcome. Thank you.